Welcome to Panicking Mannequin. In this video, we're looking at the imaging OSCEs. We're going to start off with number 1, which is the DV skull. We're going to pop over to the X-ray room and have a look. The examiners will be looking to see that you correctly position the patient, correctly use any positioning aids, determine if a grid is required, and safely take the exposure. So for this one, we're doing skull. We're going to ask our assessor to help us, so I would say, or I could show them, I would like you to support the head, and we're going to move this patient onto her tummy. So we're going to pop this patient over, like that. And I would probably pop them in a crouching position like this. There we go. We got them nice and centered on the table. So we're going to take the ruler. This one is about 18 centimeters, I would say. So you would announce to your assessor, this patient is over 10 centimeters, I would need a grid. So we must have the patient ID. So you'll probably get a little card that you can fill in, and you would just pop their name, you'd pop the date and the view that you're doing, or any other logical boxes that are on there. You're going to make sure that it's on the table somewhere. So the first thing you're going to do is ensure that your patient's head is level. Let's pop this guy here. Here we go. Because we're in the crouched position, we can set some bags to our side. We can pop him in a trough. Do whatever you need to do to get him nice and straight. And if we're sedated, you could consider using a light sandbag just over the back of the neck. Treat them as if they were real. Don't put their front or back legs in any really bizarre positions. So we're going to pop our left-right marker in. We've got our patient ID. It's time to collimate. So you're going to turn your X-ray machine on. If you're not familiar with it, you absolutely can ask the assessor, where's the on button, where's the collimation light, and where are the dials? And you're going to push your collimation light, and then you are going to collimate whilst you are telling them your collimation points. You do not need to do anything else to the machine. You don't need to worry about the KV or the MAS. So your collimation points, you want to center on the midline. A lot of them will say between the eyes, but it really depends on the shape of your dog's skull. So apply common sense, you want midline of the skull. Rostrally, we're going to collimate to include the nares. Caudally, we're going to collimate to include the atlas. Laterally, we're going to collimate to include the skin edges. Those are the points that you will need to state to your assessor. So now that we're happy with our view, we're going to step outside of the demarked zone, which is usually marked out on the floor with some hazard tape, and you're going to make sure that both you and the assessor are outside of that controlled zone. And although it's unlikely that there's going to be anyone else in there with you, if there is, make sure everybody comes out. We are going to take our button, we're going to half press it and say that we're prepping. We're going to depress the button and loudly say, X-ray. Once that's done, there's nothing that you can change about this task, so you can't go back in and reposition. That is the end of the task. Poor manual handling of the patient, or unsafe use of positioning aids, not verbalizing your centering point and your collimation points, just generally giving incorrect centering or collimation points, or not ensuring the collimation light matches your points, not checking or verbalizing if a grid is needed, not completing the patient ID card, not using the left-right marker, not using your PPE, so if they have given you a dosimeter, make sure you use it. Poor symmetry or straightness of the patient, not announcing X-ray when you push the button, and not ensuring everyone is outside of the controlled zone when you take the X-ray. Hopefully you're feeling a little bit less panicked and slightly more peaceful regarding your OSCEs. If there's any other topics you'd like me to cover, leave a comment below. I will read them and I will try and get them done for you. Bye for now.